I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Hey, welcome to our Urban Health Weekly, and I'm here with Lou and with Jackie. Hello, people. How are you?
Hey guys, how are y'all doing?
Okay, I know you guys have been following the news. How are we feeling about the Pfizer? Well, first of all, the Omicron, which we talked about. I think we talked about that last time, right? How are we feeling about the Omicron approaching us? And it's on our shores now. It's like it's here, and apparently it's been here.
I'm nervous, of course, but I'm a nervous person. Getting my booster tomorrow, and I'm glad we're pronouncing it Omicron, so we cleared that up because I was going around saying Omicron. All right.
I think everyone was going around saying Omicron.
Actually, I heard a news show yesterday that there's actually like 2 or 3 proper pronunciations.
Mm-hmm.
The British pronunciation and the American.
I listen to a lot of BBC news on the radio, and so
okay.
Omicron.
There you go. We'll go
okay.
We'll go.
Fine. We're doing the US pronunciation over here.
There's been a few, I guess we'll call these encouraging for now, reports. So the first one is from Pfizer that it looks like 3 doses of the vaccine do protect you.
Yeah, so if you get your booster.
Tomorrow I'm getting the Pfizer booster, and I have the Pfizer before, so I'm very excited.
Yeah,
outstanding.
Right. So the Pfizer product does work. It looks like based on early and preliminary results, but that's very good. Even 2 doses of it control it and keep it away. So that's all good. So it looks like our vaccine cocktail can handle it. I'm sure that if Pfizer can do it, the other ones will follow suit.
But does
that mean if you got the Moderna booster and you got Moderna, are you less protected?
Moderna hasn't weighed in really yet. They're still doing their tests, and I guess we'll know in another week's time because they always kind of lag behind Pfizer by a week or 2. Yeah. So we'll find out shortly where they stand with theirs.
Right. In terms of that, but I would assume being that 2 vaccines is so very close together, that would be a positive sign. The second sign is there's been a few super spreader accounts of Omicron already, mostly happening during holiday parties, which
I didn't know about.
Right, there was one in Norway, I believe. Attended by 200-300 people.
Oh my God.
And and
indoors.
Yeah, it was somewhere in Scandinavia, indoors. They did take precautions and all that, but regardless of the precautions, about 60 or 70 people got it. That said, no one had resulted with serious illness. Now, everybody who went to this party was vaccinated. That was one of the conditions of going to the party.
Okay.
It's interesting. So far, they only seem to be catching it in vaccinated people. I'm wondering if it's because the people who are vaccinated tend to be more vigilant and will submit to testing and all of that. It can't just only be affecting vaccinated people. I have yet to hear any cases of non-vaccinated people.
Do you think the vaccinated people are more confident going out and about?
I think unvaccinated people are just as confident going out and about. I think they are strong in their conviction of not wanting to get vaccinated and not feeling that they're healthy enough that their body's going to withstand it, et cetera, or masking up, but in any event, feeling like they're fine and it's either going to get them or it's not going to get them, and they take precautions.
I have a worse view on humanity.
What's your view?
I'll let you finish.
Well, but I think what I'm trying to say is that so far all the cases of people that they've found it in have been vaccinated people. I highly doubt that it's skipping over unvaccinated people. This is, we're all kind of saying, okay, it sounds like it's going to be fine. We don't know what it's going to be like in people with comorbidities. We don't know what it's going to be like in people who are not vaccinated. We haven't gotten there yet. We're not out of the woods. So, I'm throwing my hands in the air like I just don't care because I got my booster and my little one is vaccinated. So I'm feeling, even more confident. But, given the standard American diet and the amount of sugar and the very little, water and fresh food that people eat, I worry what this is going to do. You were saying you had your bleak
outlook on human beings. All right. Well, here's one thing. I think that most people that have not gotten a vaccine today are not going to report the fact that they're feeling bad or go.
That makes sense to me.
And unless you're like at a hospital level at death's door, you're just not gonna tell
taking
anybody.
Ivermectin at home and hoping for the
you
best.
know what?
You're admitting to nothing.
That makes sense. No, that's an excellent point. That's
ego's involved at that point.
You take your home remedy, screw the world and screw the planet, and they're lucky you're wearing a mask, if at all. And and there you go. I mean,
no, you're right.
That's the attitude that they have.
I agree with you. I have to agree with you on that. I think that's what it is. That makes sense to me. Also, I think what Tammy said, that possibly the people who get vaccinated are more community minded and they're more likely to see about getting, tested and, keep track of that. Like maybe there's more like accountability.
Yeah.
Either community minded or they work for
that requires it.
Mm-hmm. Here in New York City, the mayor just came out with something a bit controversial, but for once I'm on his side. He's demanding that everybody get vaccinated.
That private sector employees must get vaccinated.
Right. So if you're a public sector employee or if you work for the city now, there's a vaccine mandate for you. Which means
that vaccine mandate, if you were a city employee, that was already in place. Right. This new one is if you're Papa John's, your employees better get vaccinated.
Right. Or Google or
yes, any private entity,
law firm or anybody.
You can no longer say, well, my company, my rights.
Is it a size issue of the company?
I don't think they made that requirement like it's got to be 10 or more employees. I think he just made a blanket like you must get vaccinated if you're employed, period. I'm worried that people who don't want to get vaccinated are just going to decide to drop out of the, use the Great Resignation as their cover and then apply for. New York is so ridiculous. It's so ridiculous now to quit their job and then they're going to get aid from the state. It's so ridiculous. I just
more and more. I New York.
And you get to quit your job on Instagram and curse people.
Yeah, you get to go on TikTok and make a video about your whole ordeal, how you quit your job and the whole thing, and then show the sign, and then you just go and apply for money, and then you get a fat check from the state every month to stay home.
God forbid they ask you to show up at 9 a.m. How could they? My precious sleep.
Well, I'm not saying that. I'm just saying that that's the thing that I'm worried is kind of going to happen. Mm-hmm. People are just going to be like, well, I'm just not going to vaccinate, and since I've got options. That's the thing now. Like people have options. It's not like, well, look, I got to suck it up because I need my job.
Are you saying that people shouldn't be getting assistance of any kind? Because I could see.
No, that's not what I'm saying.
Okay,
that's not what I'm saying. No. I'm saying that the barrier for entry is so low that if you're
to get assistance,
right, that it's so easy to get assistance that you don't even have to have you don't even have to have necessarily lost your job.
Okay.
You just have to not be working and get money.
All right.
And And I don't have a problem with that, except that you left a perfectly good job because you decided that you wanted to take a stand for whatever reason, and you didn't want to comply with the rules of the job. And your reward is that you get money from.
So perhaps the standard should be a little bit higher.
This is not the same thing as I lost my job for whatever reason. And pick any reason: age discrimination. They called me incompetent, downsizing, company just went belly up. Like, those are all legitimate reasons a person loses their job. And I feel like that's what that money should be for, not for people who just decide, I don't want to work.
So is there a way to get better oversight on that?
Or I don't know that there is, because the need is so overwhelming that they just lowered the bar so much that that anybody who's not working, you just need to prove that you're not working. It doesn't matter why or how you're not working, you're just not working. And that's what bothers me. I'm not saying, and the other thing that bothers me is that a lot of the times the people that really need it can't get it because of the type of work they were doing. Let's say they were working off the books, a cash
any job that's not well documented.
Yeah, and then these people who have these documented jobs but decide to leave the workforce for whatever reason, for no good reason, in my opinion. Because I don't think leaving because you want to take a stand because you don't want to be vaccinated, I don't think that's a good reason to leave a job.
I agree.
But
you can get a medical dispensation, is that correct?
But it has to be legit, like, I'm immune compromised, or I'm a cancer patient,
right?
Or some other issue. I just don't want to do it because I've done my own research and I'm comfortable with the science.
I think some of this is social, but taking the conversation back to medicine, but keeping it on the social level. In 2019, I did a research study and corporate presentation, that told senior management that by 2025, a third of the workforce, as they knew it then, was going to be gig employees, not necessarily corporate employees. Another third would be working from home, and only a third would be working in the office. What's happened due to the pandemic is that was going to happen over the next 6 years, and it was an evolution that was happening, and that I felt was going to happen and continue to happen and take 6 years to happen. As a result of the pandemic, that time frame accelerated. And this almost became like 6 weeks or 6 months, or whatever you want to call it. And all of a sudden, we've evolved to that model. Now, as we've evolved to that model, it's very different. Like the rules in HR and social rules and unemployment rules and all that are now lagging. And reality has moved quicker than the rules. Usually all these things kind of work at the same pace. But because of the pandemic, all of these changes that were going to happen anyway, people working from home, using Zoom, doing this, doing that, all of this was going to happen. But it wasn't going to happen quite this fast. And the rules had not been adjusted. Now what we see happening is, with this large migration to working from home, there's a lot of conflict in the workplace and people just don't know what to do. Even Google, that's kind of like state of the art, and everybody looks at, ooh, what does Google do with it? Or Alphabet.
I mean, they pay for their female employees to freeze their eggs so that they don't miss out on fertility.
Yeah, they beat Apple.
They're a little more progressive. They're a little more modern. Yeah,
cutting edge. Yeah.
And they, first they said, all right, everybody's going to come back to the office. We think it's a good idea. They got all this space in Manhattan. Then they said, well, the virus is still here, so we're not going to fill it. They just, they were going to have a reopening of January 10th. In fact, they were having reopening parties so that people could see each other. And then all of a sudden Omicron hit and they canceled everything. And now they don't have a date. So what I'm trying to say is that the corporate planning that was there before and the policies and the HR structure is not quite there yet. And as this pandemic evolves and I guess ages, we're starting to see a catch up here. And I think that these things will fix themselves.
I hope you're right.
Wow. So that was a good point that, yeah, all of a sudden it was like 6 weeks, the floor dropped and everybody just fell into a big crevasse. And now here, corporate can't catch up all the infrastructure behind it. Do you think people are going to go back to the office, period, in the way they did?
Nah, I think once
I'm highly.
So like 2035, you had said like it'll be like a third people will be out. So it's just happening in 2022. There's going to be.
I think there still will be a social need for people to gather.
Maybe like one day a week or something like that.
Whatever the.
But here's the gag. This is the hypocrisy. Like these people that are worried about like not going back to the office and it's so unsafe and all that, to go to the local pub or to go to a party or to go to like dinner, no problem. It's no problem. But to go to the office, oh, it's so dangerous. I'm having a hard time.
That it's entirely about safety.
It's a cognitive dissonance that I just can't wrap my mind around. I just can't. By the way, Lou, what did you base that report on?
That's an interesting report.
Actually, on trends. I've done a few of these, as I've told you over the years. And I did it on trends that I saw in the marketplace, and that I saw just based on corporate metadata that I had access to, as to how employee sizes were actually shrinking. As I had been called upon originally to do space planning for a large organization. And by space planning, I had like little sensors. People were bugging out over this. I had little sensors placed underneath people's desk. And I told you, there's a sensor under your desk, but people went crazy over this. Just to tell me how often they were at their desk, how often they weren't at their desk. And as a result of this study, I found that people were only at their desk, sitting at their desk 40% of the time. And they would only show up 66% of the time to the office.
Wow.
That was your average worker. And as this survey, and I did this for a couple of years, and I saw the numbers going down. And then I said, okay, what is the date that the most number of people ever showed up to this place? And that number was 70%. The biggest day of full attendance was 70%. So picture a football stadium,
right,
where the biggest number of people that you need is 70 seats.
Yeah.
Is 70 seats when you have 100 seats.
Right.
Why do you need those extra 30 seats?
Right.
It was also based on some football data and baseball data. I'm a sports nut. And something the Red Sox did when they went to metadata at the Billy Bean and all sorts of craziness. But what they actually did is they made their stadium smaller to make the demand for tickets bigger. So if you contract the amount of space that we needed and made it more of a share type thing.
Right.
And only like legal and HR have their own areas because obviously they have sensitive documents. Everything else is paperless. You can just go up, grab a desk, and get to work.
Oh, so that's how you came up with that kind of like workspace idea where it's like you put in your time. Okay.
And Green Space was working on it, and I think we're going to see a lot of that. A lot of the stores right now, for example, SPG. Which is a big mall company, is turning mall space into green shared space.
Simon Property Group.
So Simon Property Group is actually Lord and Taylor's, which kind of had gone out of business.
Oh yeah.
They're turning these Lord and Taylor's into shared office spaces, and people are flocking to these things because you're doing a shared office space in the mall, much like Tammy said before. People complain about working if they got to go somewhere, but hey, imagine working at the mall and you can go shopping and all of this. All of a sudden,
also they're going to a place they want to be at, and they can choose whether or not they're going in, right?
Right. So there's parking, there's access to transportation.
And do they have to be there at a certain time every day, or
shared space? The company provides 20 desks or 40 desks or whatever. And it's between you, your boss, and your coworkers when you have to show up.
Yeah, and then you just kind of like schedule the time, like I'm gonna need it from X time to Y time. By the way, did you guys hear about the company who did a Zoom meeting and fired like 900 employees?
What?
Yes. Yes.
On Zoom?
Real estate group.
Yeah, so it was, I forgot the name of the company. It was a real estate company. They just went public and they had like this really great valuation. Not to, we're sort of getting off topic here, but I just thought it was important. Speaking of productivity, that's what made Speaking of productivity, that's what made me think about it. So what happened was everyone that was called to that Zoom meeting, the CEO basically told him, if you're in this meeting, it's because you're getting fired today.
Oh my gosh.
But the reason he did it, and he was advised not to do it that way, but you know, the reason he
terrible optics, by the way.
Horrible optics. The head of PR quit. The person quit after that.
Well,
another marketing person.
He let them go gracefully. He just said, "Look."
Well, what happened is he posted he anonymously posted on some group that basically these employees were stealing because they were only working or showing up for work 20% of the time. 20%.
Mm-hmm.
So these 900 people, and I'm not saying what he did was right. I don't agree with what he did at all. I'm saying that going back to what Lou was talking about in terms of productivity, that these people were only working, they were putting in that they were working 8 hours and they were only working 20% of that time. What is that? How many, you're the math.
I think 2 hours. They were doing two out of 8 hours.
2 out of 8 hours a day.
They were averaging less than 2 hours a day. So when he saw,
so it looks like he was like making an example. Is what it sounds like.
Yeah. I mean, it was very punitive the way he did it. It was a bit humiliating the way he did it. Did he have a good reason to let them go? I guess so. Mm-hmm. Did he do it the right way? Absolutely not. Mm-hmm. It is stealing if you're saying that you're working 8 hours and you're really only working 2. But that's going back to what you and I were talking about before with people doing a lot of jobs, and you doubted when I said that people do jobs. And I'm telling you that that's what's happening, is that people have decided, well, now that I'm working from home,
I'm doing my side gig.
I'm going to do my side gig. Exactly. Since I don't have to show my face, I'll just pretend I'm putting in 8 hours here. And I'll pretend I'm putting in 8 hours there, and I'll collect all these different salaries. And instead of making 80,000, I'll make 160,000. Yep. Because I'll put in, half or a third of the effort at each job, enough to keep me on the payroll, and I'll just make more money. Yep.
Yeah. Well, with that, I think we need to take a break.
Yeah.
The time our sponsors are very angry at us. We're going to interesting conversations.
Let's take a break. We'll be back.
Frenchman to Oak Street, Treme, Gentilly, and the CBD. V102.3, WHIV FM, the vibe of the city for human rights and social justice. WHIV 102.3 FM.
And we're back. And we were originally talking about the Omicron variant and medical news of the week. A reason for optimism on Omicron: our immune systems are not blank slates. This is from Stat News. New COVID-19 variant with a startlingly large array of mutations has countries around the world sounding alarms. While the concerns are understandable, experts in immunology say people need to remember a critical fact. 2 years and 8 billion vaccine doses into the pandemic, many immune systems are no longer blank slates when it comes to SARS-CoV-2. The new SARS variant, known as Omicron, may more easily sidestep some of the immunity of some vaccinated and previously infected people, but there's good reason to think people who already have some immune protections may avoid the worst of what COVID infections can do to immunologically naive, meaning never been exposed to it previously, people. I have to say, I'm not really terribly worried about this because, like as I said, I have the booster, and Pfizer's CEO, Albert Bourla, I call him Baller Borla, said that the booster puts you in good shape. Oh yes, he came out and he's like, oh, we've planned for this eventuality. We're prepared for this. And I was just like, oh, thank goodness. As long as we avoid sugar, drink plenty of water, and keep the processed food to a bare minimum, I think I can survive this.
All right. I got to work on the processed foods for my little one. That's a bit of a problem.
It's like if you don't put stumbling blocks in the way of your immune system, then you can get through this, you know. But you have to sort of be disciplined, and that's what worries me. Like some people are saying, well, it's no big deal. It's no big deal if you're a healthy individual. It's no big deal if you eat a healthy diet or you're within a healthy weight. You don't have comorbidities.
That's not most,
particularly diabetes, right? Yeah. Exactly. That's not most people. So I think the jury is still very much out on this. The healthy world is like, looks like nothing to worry about here. I got my booster, I eat healthy. Mm-hmm. But it's the other side of the equation that worries me still, that we haven't seen the other shoe drop yet. What are you guys' thoughts on this?
Keep wearing masks.
Well, yeah.
Yeah, I mean, I'm the same way. I mean, pretty soon they'll have a shot that gives me a good mood.
And the other thing is they have the therapeutic. If for the non-vaccinated, for those who do get sick, they've got the therapeutic. I wonder how much that therapeutic costs. That Plaxo, what did they forgot the name of it? Some Plaxovid or Paxlovid.
I also want to know how easily available it is. Isn't that only for when you're like incredibly ill?
Yeah, there's blogs out there now that people are going and demanding that are not incredibly ill and demanding the pill and all of that. Yeah.
These are the same people that were suing the state for their right not to get vaccinated.
Yeah, I thought, I thought we were off the topics of lunatics, but I guess every time we get out of the topic here, we go back to lunatics.
But you know what? And I'm just playing devil's advocate. Those people think that we're lunatics for putting this poison in our body. So I'm just, I just want to give it a little perspective, but go ahead.
Right.
Yeah.
I'm not disagreeing with you. I'm just,
Yeah, like medically, when these interventions are, what's becoming a little bit of a controversy is like medically when these interventions are necessary. By interventions, when should I prescribe X, Y, or Z now? That we have an escalation therapy arsenal. And it's kind of like the military. At first you send out your gunships and your troops, and then when do you call out the nukes? And it's the same here.
Hopefully never.
Yeah, exactly. Hopefully never. And that's what the medical community is trying to say is like, let's just save these drugs for when we absolutely need them. Not like, hey, I tested positive for COVID. I'm feeling fine, but can you just give me this thing just in case?
Can I get a dispensation?
Yeah, can I have it? I want it in my medicine box so that I'm feeling kind of sick. And it's a natural result. It's a natural request. But right now the answer
is it a natural reaction? That's a natural, really?
That's how people are.
Not let me take an ounce of prevention and get the jab.
No, I think that's not the natural reaction. The people are impulsive. You have to impose things on them.
Right. But he was saying that the natural reaction is to say, well, I'm feeling okay, but I want that drug just in case I do.
Okay.
So I'm just trying to put that side by side to the vaccine that's available and you can actually get. I'm just trying to make sense of it all, Jack. Right. That's all. Just trying to make sense. Oh man. 7 policies in Biden's spending plan aimed at health equity. After years of advocacy led by Black women in Congress, Democrats are poised to make a substantial investment in services to promote maternal health. The centerpiece of the maternal health provision is a policy that would force states to cover more mothers on Medicaid for a year after giving birth instead of the current 60 days. A federal COVID-19 relief bill passed this spring included an optional path for states to expand that coverage, but only about half of states have adopted the policy. Other investments include funding to address social factors that affect mothers' health, to promote research at minority-serving institutions, to diversify the perinatal health workforce, to increase data collection, and to conduct bias trainings for health professionals. Another policy that will allow low-income people in expansion states to receive premium-free insurance through the Affordable Care Act exchanges funded for 4 years. That expansion is going to cost $57 billion per congressional analyst estimates. There's also making CHIP, which is the Childhood Health Insurance Plan, permanent. That's another initiative.
Yes.
The list goes on, and if you want to learn more, you can visit Stat News for their extensive coverage on it. But I'm going to stop here because it just goes on and on. I think that it all sounds good. I'll wait to see what actually gets passed. What do you guys think about this?
Well, I'm very excited for it. I feel like this kind of stuff is going to save money in the long run for this country, and it's just more humane and probably more effective.
I agree with everything you say. However, it's one of those. In order to save your life, I'm going to have to kill you. The federal government has set a terrible track record historically in implementing anything. And in most cases, things cost more money to implement than they actually save. So every time they try to save $1, they spend $2 by saving it. Now that's across all fields, not just healthcare. We talk military, roads, whatever it is. So on one side, I think that the highbrow of this is great. However, it's all in the implementation.
There's some things, for example, they've already got a track record of like Medicaid and a track record of CHIP. I mean, some of these things,
right?
It's not like brand new concept. It's just expansion or making them permanent.
Right. Mm-hmm. Like I said, I'm going to reserve my judgment and see what actually comes to fruition. Another one that another one of the points is home and community-based services for the elderly and disabled people. Elderly and disabled have always gotten the fuzzy end of the lollipop, in my opinion.
Yes.
So, I think it all sounds good on paper. I want to see actual policy and actual execution on the ground level and see what that looks like. So I'm just going to reserve my judgment on that and just remain hopeful, because that's kind of all I can do.
All right.
Okay. Well, speaking of implementation, successful or unsuccessful implementation. So President Biden announced a plan for free at-home COVID-19 tests as part of his effort to tame the pandemic this winter. The catch, though, is that people will still have to pay the cost up front for the tests, and then they have to submit the receipts to the health insurance to get reimbursed. Pain in the ass much? If anyone has ever submitted a claim to insurance,
that doesn't, oh God.
You know exactly what's going to happen.
It could easily take a year, or first they deny.
Exactly. Yeah. You're going to send them a bill that you paid for $30, and they're going to send you $1 back in the mail.
Dial back and tell you
6 months later, and then they're
going to ask for more documentation, or you're going to have to do a thing, and then by then you're going to be so exhausted that you just will give up.
I mean, the money it's going to take to fax it or mail it, it's just not even going to be worth it. So this is just another one of those things, and that's why I'm reserving my judgment, because it's like, okay, this sounds good on paper.
Let's see how they execute it.
Yeah, the actual execution, not so much. So
I gotta admit that 50% of all receipts are lost by the time I get home.
I was wondering what that number was, because I would say a ton are lost. I'm notorious for not being.
I'm talking about me. I lose by half of them. And then after that, it's each plan has deductibles and this and that, and then you got.
I wonder how much they count on that. The fact that people are just like, they're not good with paperwork.
Yeah.
And
well, but the real question is, should the Biden administration have thought of that to begin with?
Definitely.
Yeah, these are people who make these policies who clearly have never had to do anything like that in their.
Or they're already experts in paperwork and they have people.
Yeah, but that's my point. That they don't physically have to go through any of this stuff.
They don't have a clue in that area.
Right, they have zero clue. And I'm just gonna put one thing out there. You guys said you guys always lose your receipts. As a Black person, I never lose my receipt because I'm always worried that when I get to the door that the security is going to ask to see my receipt, which as I get older, that doesn't happen as much, but it used to happen to me all the time. I get to the door and they always want to see my receipt. So I've trained myself to always have my receipt handy just in case. So
wow.
Yeah, well, welcome to the Black experience.
That is a different experience. Oh, I forgot my receipt. Well, next time, bring your receipt. That was my experience. Wow, I've been getting away with nonsense for a long time.
Yeah, not mine. Mine is more like, did you not just see me leave the register? I'm going to need to see your receipt, ma'am.
Yeah.
Wow.
Here it is. Just take it. It's all here.
Yeah. That's better than my belligerent attitude of, can I see your receipt? And I would just say, no. And then I just look at them and then they say, finally, I just say, okay. Oh.
I just trained myself over the years to keep you see my wallet so bursting with receipts from like 2 years ago because I keep them because you never know.
Where do you put them after? Do you have like a big box you stick all your receipts from that year in?
No, I mean, I throw them away after a while, like I know, well, I keep them because I always keep them because I like to have them handy as I approach the door. But then I keep them because suppose I forgot something at the store and I need to prove that I bought it and I didn't get to take it home, or something happened, like maybe I opened the package and something's wrong, then I'd like to be able to go back to the store and I don't want to lose the receipt. So for those eventualities, I'm always very cautious about making sure to keep my receipts. And then I have this habit of, okay, something may not happen today, but maybe tomorrow, maybe within the week, maybe something will break. So I keep the receipt. And then after like maybe 2 weeks to a month, I'll be like, okay, I'm not going back to the store. I don't need this receipt. And then I'll throw it away.
Right.
But I do keep them for at least 2 to 4 weeks, just to be on the safe side, just in case anything happens. But especially that crucial, 24 hours where, I'm heading to the door, and just to be on the safe side, I have it in my hand. Or if they accost me in the shopping, in the parking lot, that has never happened, but I've heard of stuff like that happening.
Wow.
Incidentally, I've also heard of interracial couples arguing about the receipt, where the white partner will be crumbling it up to throw it away, and the Black partner will be like, "Are you crazy? Get the receipt." We need that. That's a different reality, y'all. Different reality.
Well, in Europe, I do have one final comment on this. In Europe, many of the tests are freely available or available for a very nominal fee, from $1 or a pound. Or
that's the thing. They don't even make the consumer go through that.
Right.
It's like you just get
However, they have a different economic model.
Yeah, let's not get into that.
Yeah. Yeah. They have a different
economic subsidies, but let's not get into that.
So we can't really compare ourselves to that, but I think there's definitely a better way. And I think the policy is a very good policy. However, the implementation
You think the policy to pay for it out of your pocket?
No, I think the policy that the tests be made widely available to people for low to no cost.
But that's not
a good policy.
Okay.
However, the implementation of this how leaves so much to be desired.
It's not really a free at-home test if you have to pay for that's not free.
Yeah, it's definitely not, because sometimes we don't have the money to put out.
That's what I'm saying. Well, you don't have that $20 to pay out of your pocket to begin with.
The concept is good.
It's a terrible concept because it's not actually free. It's disingenuous.
Well, it's not implemented.
And it also assumes that people have insurance. What if you don't have $20? And what if you don't have insurance to submit the claim to for reimbursement?
Well, what if I just say, I want everybody to live forever? That's a great idea.
Oh, come on.
That's a big jump.
That's unfair. No, that's not.
It's
No,
a good idea,
it's not.
but you can't implement it.
It's not. If you can't implement it, it's not a good idea.
No,
Correct.
I disagree. I think I can have a lot of good ideas.
How is this a good idea? It's not free. It's not free. To say that it's free is disingenuous. Period.
Okay.
It's not free. You have to actually shell out money plus tax wherever, depending on your state, and then you have to hold on to the receipt, which, as you guys pointed out, most people don't even make it home with the receipt, and then you have to dig up your insurance information, and you have to mail it to your insurance company, or you have to call them and get. Who wants to go through that? That's not free.
That's not free. And it ends up being not free because nobody finishes all that other side business of the
how many people even clip coupons, and it's in your newspaper and it's on your phone a lot of times. And most times people don't even do that. And that's
inefficient, and it looks like that might be built in there.
Yeah, that's all. So, his heart's in the right place. We can say that his heart's in the right place, but we cannot say that this is a good idea. All right, so we're going to take a quick break, and we'll be right back.
From the lower 9 to uptown, mid-city to the West Bank, we got you covered, New Orleans. WHIV 102.3 FM.
And we're back. Hey guys. All right, so let's move on. And I wanted to talk about Black and Hispanic men contracting HIV at the same rates as 10 years ago, despite all these interventions. Despite numerous advances in the prevention of HIV, new data show that the rate of new infections among Black and Hispanic, Latino, gay, and bisexual men did not decline over the past decade. Officials say finding from the Centers for Disease Control and Prevention, or the CDC, underscores the need to address underlying social issues and gaps in the distribution of care, even as public health initiatives continue to try to reduce HIV rates. Overall, new HIV infections among gay and bisexual men declined 8% over the last decade. That's not much, report found. But most of that decline was caused by declining rates of infection among white gay and bisexual men. Among Black and Hispanic, Latino, gay, and bisexual men, rates stayed stable, and any changes were not statistically significant, if at all. I'm at a loss here, y'all. I just don't know how a researcher is supposed to, how are they supposed to intervene in risky behavior? I'm not really sure what to do there. 8% is not a huge decline over 10 years. That's a small number, which means we're not even really making a dent. We're just keeping people alive, and bodies are not piling up because of the therapeutics that we have available. But people are getting infected.
Do you think it has to do with stigma? Is that a possibility? Because in order to, we were talking about last week how people were they're more comfortable and felt less stigmatized at an AIDS clinic as opposed to, speaking, they weren't necessarily feeling reassured at their regular healthcare provider. Like it needed to be like an AIDS clinic. Do you think that that's interrupting the situation, that they're still underlying? People aren't necessarily going, discussing with their healthcare provider. If you need to be, advanced planning.
Yeah, well, see, that's the thing. That's the part. The part is the advanced planning, right? So like, in order for me, okay, so like, for example, PrEP, the drug, the prophylactic drug that's available to people to take to prevent HIV infection. I was reading that education about PrEP in the Latinx community is not really, it's not really penetrating. So the thing is, in order for you to have a discussion with your doctor about something like PrEP, aside from the fact that you should have a doctor, which a lot of young people don't, you have to have some forethought and some plan, which means you have to think or believe that you are at risk, which I'm not sure people who engage in risky behavior do risk assessment and think I could be at risk. So in order for you to plan for risk, you have to believe that you are at risk. And I think that's where that's where the breakdown is. And that's why I'm saying, how do you intervene and change risky behavior? Because a lot of it is risky behavior. I don't know if it has to do with shame or anything. This is probably like
it might have to do with youth, just being young.
But behavior, risky behavior is not just for young people.
Right.
A lot of men who sleep with men, for example, and this is not just men that sleeping with men. This is a lot of people.
This is all people who engage in sexual activity.
Activity.
It's designed to be,
right. Who get
desirable
involved with strangers, and that whole illicit behavior and that whole thing has been kind of glamorized and it's just not, no, people don't want to think about it. They don't want to, they want to be in the moment.
Right.
So how do you intervene? What kind of intervention can you do for in the moment? And there are people who don't feel that this is their problem. This doesn't apply to me. I'm young and healthy, or I'm healthy and I'm good looking, and I'm just going to go, I'm going to have fun. I'm going to drink. I'm going to meet some sexy guy or gal, and I'm just going to have fun. I'm just going to throw caution to the wind. In order for you to not have that kind of attitude and to be a planner, then you don't have that same romanticized throwing.
Right. That's why it has to be way ahead of time. But somebody has to be comfortable.
Right. Well, somebody's got to wear the big boy pants or the big girl pants and say,
right,
I could be at risk. And that's the thing. Do you feel that you're at risk? And a lot of these people, I'm sorry to say, a lot of these people who behave in risky behavior don't feel that they are at risk. You have to feel that you're at risk.
Think about it because they're so young, or do you think it's a case of like they just feel they're, because young people really think that
inhibition is romanticized. Inhibition is romanticized. Okay. You don't see segments on a lot of these shows of people going to the clinic. I think, a lot of these shows would do young people a service. Like one thing I liked about that show, Girls, was that they always told the guy, please make sure you're wearing a condom. Okay. Do you have a condom? When I see shows doing stuff like that and putting it out there, or like, oh, just a second, let me get my condom. That to me is what you want to encourage people in. And a lot of this caution to the wind stuff is just like romanticized, and it's like an afterthought, and you figure the person looks good, they smell good, the pheromones are kicking. What could possibly go wrong?
It's too late then. You have to be ahead of time because the brain can't stop at that point. You're just going to lurch forward.
Exactly. Okay. And then there's a lot of alcohol involved in these decisions.
Yeah, so you're already disinhibited. Yeah.
Right. And so how is science, how is research supposed to intervene on that? I'm just wondering how they do that. Like, what are your thoughts on this, Lou?
Well, here's the thing. I'm not even going to go to this pandemic. I'm gonna use an adjacent pandemic, which is the opioid pandemic, where I was doing a bit of research on. I'm full of research today. Just don't tell me what I'm full of.
Full of research.
Yeah,
well, that's an epidemic.
But here's epidemic.
All right.
So with the opioid, the numbers were interesting. 80% of all users are white, and 20% are minority on the opioid epidemic. Mm-hmm. Yet, when you look at deaths, and that's the people that are hooked on it. Mm-hmm. When you look at deaths, there's more deaths on the non-white sector than there is on the white sector. Now, how could you...
Wait. There's more deaths on the non-white sector or the white sector?
More deaths. We're just talking about absolute deaths.
So, in the white sector
of the 100% of opioid users, 20% of them are people of color.
Right.
But the majority of them are the ones dying from the opioid.
Oh,
right.
Okay.
So why? And that's something that they looked into. Now, this is an area that's been lately funded quite a bit with all the lawsuits. So we're starting to learn why. And also, as most of the victims are of the white nature, of course, the money flew there. But let's.
I'm so glad you said that, but go ahead.
They started looking at it, and they found that on the white sector, they were 35% more likely to go to a clinic to either seek help or seek products that would help with the addiction.
Like not naloxone or whatever.
Right, whatever that.
Oh.
Yeah, I didn't do my research for this segment, but it's a very interesting corollary. On the non-white sector, and the non-white is Hispanic, African American,
people of color.
Yeah, people of color. That group was 35% less likely to seek out help. Now, I think what we're looking at on the HIV sector, and let's throw them all in there, is a distrust of the system. I think
An avoidance of being connected to the system.
Yeah, it's not as much irresponsibility or lack of wanting or anything else. Is that
I didn't say they were irresponsible. I said they were engaged in risky behavior.
Well,
there are responsible people who engage in risky behavior. Look at all the married men that are cruising and down low.
Well, that's the whole thing. Number one is there's a distrust of the system. So let's put that one on the bulletin board. Let's put it on the parking lot and walk away. That's reason A.
Okay.
Reason B, as Tammy just correctly pointed out, is there's a lot of stigma still here.
Right.
Number one, people that are on the down low are not going to show up at the HIV.
Yes.
It's not going to happen. So let's look at that population. It ain't going to happen. They're not going to have that in their medicine cabinet. They're not going to have that.
Oh yeah, you just got outed.
Yeah. Number two, when we look at I know of the Hispanic community very well because I'm part of it. But I think it's also part of the African American community. There is more of a stigma to being gay in those communities as there are in the white community. Yeah, that's my feeling. That's my feeling.
No, you're absolutely right.
Culturally.
Preach.
Yeah. Culturally, if you are not traditionally sexually oriented in the Latin community, there's a lot of grief there that goes there.
Yeah, and if you're not cisgendered or heterosexual, that's right.
Yeah, there's a lot of so just being, hey, I saw blah blah at the clinic or something like that. There's a lot of stigma if you're seen there. So that added stigma, the distrust. I think when you start adding all of these factors together, you start getting a trend towards non-compliance and towards non-protection. Because there is a problem with going there. I mean, what are you going to do? Go there in the middle of the night? I mean, it becomes very difficult.
No, you're right. But you're absolutely right when you bring that up. I'm going to also say that it's all of the above because I strongly believe there is this culture of romanticizing, throwing caution to the wind. There is that distrust, but there are a lot of people that are out and proud. And so there's no reason for them to stay away from a clinic because everyone, it's pretty clear, they're not, hiding, for what they are. But, this is afflicting them as well, the out and proud. So it's definitely a culture of throwing caution to the wind and this whole romanticizing of like, oh, it's just not fun to plan. And it's got to be a chance encounter with a dark and beautiful stranger. And that whole idea of like, well, who's going to plan for that?
Yeah, that's hot. The other stuff doesn't feel hot.
Exactly. It's not, planning is not sexy. Thinking about your mortality is not sexy. So I agree with you. Do you agree with me?
I agree with you.
I have to agree with myself more.
It's all of the above.
Okay.
The whole point is like.
Also, people don't congregate the way they used to, right?
Everything is online now. Everything is online. You got Grindr. If I would love it if Grindr
had that
pop-up ads. Like, hey, don't forget you're gonna hook up. You can get some condoms at your local. For example, if you use what's that driving app, Waze. Waze every second where you're driving, and it's so obnoxious. But every second you're driving, they're like, "Oh, by the way, you're passing a Burger King. By the way, you're on your you're about a mile away from Dunkin' Donuts if you just hang it right here."
A lot of that implies if you could get it, can you get PrEP like
well, not just the PrEP, but I mean condoms is like the easiest thing you could use. And I'm just saying, like, let's say Grindr had pop-up ads that said, "Oh, and by the way, before you on your way to your hookup, wherever you drop the pin, there's a Dwayne Reed or there's a CVS, and you can get some Magnums there for, for low price, buy two get one free or whatever." You know what I'm saying? Like if it was baked into the app, where people thought about it, and it's like, "Oh yeah, okay, that's a good point. Let me stop," and because then that takes the stigma out of it, and it just becomes part of the routine. Like it was just so much.
Yeah, so when something's involved in a routine, then you don't have to think about it. And
it's like, "Oh yeah, okay, that's good. Let me stop at the pharmacy. Oh, it's right over here. Okay, great. I'll stop here. I'll pick something up just in case something happens. And that's not happening anymore. Like when I was coming up, it was part of the conversation. It was always part of the conversation. Rappers talked about it, wrapping it up. Rappers rapped about it. Like, "Oh, you got this disease. Go see the doctor. Put a condom." Even the reggae songs. Wearing my rubber shoes and all that other stuff. But it was, but it was part of the conversation. And there was no stigma involved in it. It was just like, "Of course, dummy, wrap it up."
Is it because it's specialized? I like what you said about, like, let's say on Grindr, if they had like pop-ups, that makes a lot.
Absolutely. What's the other one?
That's direct marketing.
Swipe right and swipe left.
They can micro-target.
Is that still Grindr? Swipe right and swipe left? What's that one? What app is that?
It's not Grindr. It's God,
we're so old. We don't even know the name of the goddamn.
Hold on, let me get on my phone here and see who I've been looking at. Okay, Granny's for Grandpa. That's
no. Come on, what's the name? Swipe right. Jackie, you don't know the name of the app?
Man, I forgot.
You're so old.
I'm so old. I'm so old.
Yeah. Oh my God. Well, anyway, that app.
Right.
You young people know what we're talking about. Anyway, final thoughts?
I like what you're saying. I like that idea. I find the whole thing, I would like to know if they could get some kind of public service, but your public service announcement, you're saying though, maybe we need big federal money behind it. It's got to be a priority.
I think there needs to be some federal funds behind giving these apps some money to run these ads and saying, "And by the way, your nearest pharmacy is 0.6 miles away, right off of route whatever."
Yeah, I think the drug companies would be more than happy to put the bill on this and advertise their product.
Okay.
Yeah, but we're talking about condoms, which is like a basic thing.
I'm thinking
I still think there's a stigma in advertising this stuff.
Yeah.
I rarely see during the NFL game, here's a thing from Magnum.
I have not seen any of those ads.
You had them, but it's
not as much.
It's not as much anymore. And sometimes you start, again, remember, we live on coasts and there's a whole country in between the coasts.
Yeah.
And I just don't think that this is 100% palatable for all of the U.S.
Well, you were talking about your high school experience, and my high school experience was completely different than yours.
What was your high school?
Well, I went to all girls Catholic boarding school, so I was shipped away, and there was no sex ed, nothing. There were no condoms. We were taught abstinence, which has never worked in the history of humanity.
Ever, right?
And, yeah, so. There was so you had you had a practical experience.
Yeah, we had a health center.
Right. No, there was none of that where I went.
Condoms galore. And
good God, certainly not.
Condoms, and it was like, "Hey, hi, bye."
No, absolutely not. Nothing of that. Goodness.
All right, guys, that's all the time we have today. You guys are terrific as always. I love you, and I'll see
fun talking to you. Love you guys. All right.
Bye.
Bye.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.